The national NHS watch list is being published this Thursday and Birmingham is expected to be on it. It could lead to a second lockdown for the city. West Midlands Live is joined now by Dr Justin Varney, Public Health Director for Birmingham. Thank you for joining us. What has led us to being in this position again?
Well, I think what we've seen is a gradual increase in cases since we've come out of lockdown, and that's somewhat expected as we've socialised a bit more, we've caught up with friends and family, we've started to go back into workplaces, numbers have increased. But certainly over the last 2 to 3 weeks, the numbers in Birmingham have increased faster than we were expecting, and that's really reflecting a mixture of those two things. But when they go on their lunch break or they go out for a cigarette, that's where they forget and come together. And it's that socialisation that's really seeing this virus spread again in the city.
You've issued local guidance to care homes banning visitors. Should people who are also more vulnerable now consider isolating?
So we're not reinstating shielding at the moment. What I would say is for people who are vulnerable, you need to be alert, but everyone should be alert at the moment. It's not for any one part of the population to take responsibility for this. It's for all of us across the city.
And what can be done in order to avoid a second lockdown?
So I'm afraid it's very, very simple things that we can do to avoid lockdown. And those are the things like keeping 2 meters distance when we're outside the house we live in. When we visit friends and family, I think be sensible, visit in small numbers because it's easier to keep that distance. Remember to wash your hands and avoid touching your face if you haven't washed your hands. Wear a face covering when you're going inside a building that you don't live in. The face covering should cover from your nose to your chin, and it needs to be made of fabric so that keeps your germs close to you, and that will stop you spreading the virus if you have very mild symptoms or you don't have any symptoms at all.